Dayna Johnson here with Ray Dental Management, and I was asked today to give my input about where I see practice management software integrating into the dental office team, and kind of where I see the future of practice management software. And since I've worked in a dental practice for over 20 years, I can kind of see this big change from when I worked in the dental practice, from managing these manual paper spreadsheets and these paper systems that were extremely time consuming and put a lot of strain and stress on the front office team, where they had to gather a lot of this data manually and put it in a spreadsheet. And so what I have seen practice management software is doing is eliminating a lot of that manual data entry and pulling out, extracting data out of the practice management system in a more automated way. But what I see in the future is going a lot more towards that. There's a lot more that the practice management softwares can do to automate this system for the teams. Now, Dentrix Ascend has really started to move towards this really intuitive way of extracting data. So let me give you some examples of what I've started to see with practice management software with Dentrix Ascend. Is they have a feature called GPS, which is Goals, Problems, and Solutions. And this feature, what it does is, if you are the financial coordinator, say, in your practice, and you tell the practice management software, I'm the financial coordinator, it will create a dashboard for you that will look at all of your information automatically. So it'll tell you, you have 5 claims that need attention, and your accounts receivable, you're over 90, there's 5 accounts that need your attention, or things like that that are financially need attention if you're the financial coordinator. So if you are the scheduling coordinator, then you might have a dashboard that puts your attention towards these 3 people broke their appointments over the last week, you need to get back to them. So Dentrix Ascend has already started creating intuitive dashboards. Also, they have started a system or a feature called Nuit, which is a natural user interface. And what this does is it will automatically track your day-to-day clicks. So if you click into this feature and this feature on a daily basis, and you kind of go in this order, then the practice management software will remember this and kind of create your own kind of pathway through your software on a day-to-day basis. So for example, if an insurance company usually pays you within 10 or 15 days, then your claims from that insurance company will automatically start coming up in your insurance overdue at a certain time. So those kinds of things are already happening with Dentrix Ascend, and I'm sure that there are other practice management softwares that are starting to do that as well. But Dentrix Ascend is obviously on the forefront of that, those features. I can definitely see that they can go a lot farther. For example, on the clinical side, let's say that the doctor is treatment planning a crown, for example. Now, the practice management software should know that if I'm treatment planning a crown, I need a diagnosis, so it should automatically pop up for me what is the diagnosis for that procedure. The software should already know if you do a crown prep, you're going to need a crown seat. So it should automatically know that just intuitively based on user preferences. Also with the hygienists, when they're perio charting, I believe that if you perio chart certain pocket depths, bleeding levels, bone loss, things like that, the software should automatically know what classification of perio status that this patient would go into. So there would be some kind of a pop-up that would say, okay, based on the input that you put into this perio chart, this patient is a class 3 moderate periodontal disease or something like that. So I can definitely see where the practice management softwares can go much farther into this intuitive thinking with the clinical side. And then with front office, where I could see some future features built into the front office is, for example, if you are the insurance coordinator and you put into your insurance database that this insurance company requires a pre-estimate, that as soon as the doctor treatment plans that crown, that it would let the front office insurance coordinator know the doctor just treatment planned a crown, this insurance plan requires a pre-estimate, so here's the x-ray, here's the narrative, and boom, it's all ready to go for you. So I can see where the clinical, the front office, and the insurance submission can all happen like all at the same time, and the computer software knows that chain of events. So I think that I would like to see that, and I can see that happening. That should be a pretty streamlined system into the practice management software. Also, when I talked about earlier dashboards for specific team members in the practice, like the assistant. So if you're getting low on supplies, there could even be something built into the software where if the doctor did 3 implants last week, the software knows, oh my gosh, we're getting low on implant supplies. So the assistant could have a dashboard for supplies. So I really feel like the practice management software in the future is really going to start thinking for us and for the front office and the clinical team in a way that hasn't happened yet. Eliminate those manual systems for us, for the front office and the clinical teams, so we can focus on patient care and not have to focus so much on the day-to-day tasks that we have to do. I would like the practice management software to remember what we need to do on a regular basis. So let's go shine and practice management softwares, and let's make them more robust for us in the future. So thank you.